Welcome, everyone. I'm Rhonda Miyasaka, and this is Serge Harb, and we do structural imaging at Cleveland Clinic. And so we're going to be spending a little bit of time this afternoon just using some software on the laptops to do some kind of 3D cropping, reconstructions, measurements, things like that we're able to do offline. And thank you so much for Neil Greenberg for helping. He put a lot of work into this, and Amy, to you as well. This kind of one of the biggest challenges we sometimes have here is just making sure that people are staying on the same steps. So we'll try to go slowly, but if at any point, if there's something that's not working, what you're seeing on your screen doesn't look like what's on my screen, raise your hand. We have people that can kind of come to you and make sure that everyone's coming up to speed, okay? And if any questions, raise your hand. This is meant to be interactive. The whole point is for us to have a fun conversation and have fun with 3D, so don't be shy. So the first case that we're going to start out with, if everyone looks at their laptop, is going to be this case, the second one down, rheumatic mitral stenosis. So go ahead and just double-click on that. And so now all of you should actually see two images on your screen. And then after this, we are going to select the image in the upper left. Okay, so that's going to be keeping the control button down and then doing a left click so that we have this image highlighted in yellow. And the software that we're going to use to do these reconstructions is going to be EchoPack. So if you guys have EchoPack, you can just go ahead and click that. If you don't see EchoPack on your screen, you just click that little down arrow and you'll select EchoPack. Okay? Is everyone kind of at this stage? We're going to be selecting EchoPack. And so that is now going to launch our EchoPack software, and this should be the first screen that pops up for everyone. Okay, are we good? Does it look like everyone has this image? I think we're good to go to the next step. Okay, so within EchoPack, this is actually a really nice program. You basically have all of your 3D cropping reconstruction tools. So I'm just going to highlight a few of them, and then we're going to go into using multiplanar reconstruction to be able to do a mitral valve area. So the first thing, few tools to highlight, all of your different tools are over on the right side. One thing that people often like to be able to do when you're looking at a 3D data set is you want to look at the valve from either an atrial view or a ventricular view, and you just want to look at the 3D image. And so to do that, if you go over to the right, you'll see a button that's called 2-click crop. If you click on that, then the next step is you can come over to your images over on the left, and the first time you click the mouse is going to be where you want your eyes to be. And then you'll see that arrow. So that arrow is basically pointing, saying this is where I want to look. Like if you drag your arrow this way, you see how the image over on the right-hand side is kind of changing depending on where I'm looking. So if I want, for example, a ventricular view of the mitral valve, I'm going to say, okay, I want my first click to be in the left ventricle. I want my arrow then crossing through the mitral valve. And then I'm going to do another click in the left atrium. And so what that does is it actually crops this image so that we're only including the data that's in between these two lines. So now we have this very nice looking ventricular view of the mitral valve. And if we want to kind of look around it, we can actually just grab it with our mouse and we can move that image around. So you'll notice as I'm moving this image around, we actually see over here on the right there, you can actually see the left ventricular outflow tract and the aortic valve. So remember, this is surface echo. And so it actually is, I think it's amazing, what we are able to see on a transthoracic echo that has nice 2D images. You can get amazing 3D images, and you can get a lot of data. So this, we see all the classic features of rheumatic mitral stenosis. We see that we have, thickened leaflets. We have that fish mouth appearance of the mitral valve and mitral stenosis. Some other fun little features, there's this button over here on the right called Flexi Light that gives us this little this light that we can move around. So, for example, if I wanted to highlight that LVOT and aortic valve in the background, I could put the light there. If I really just want to be able to show the doming of the mitral valve, I can put the light kind of over here, and then I can click to drop the light in that location. I can even add another light and drop that light in another location. And you just see it just adds to kind of our depth perception of the valve. This is, it's fun. Sometimes I think it can be helpful when you're looking at 3D structures and you want to be able to see, movement in 3D space. Sometimes I think these actually can be clinically helpful. A lot of times, we're doing this to create a pretty image just to help kind of highlight what we want to look at. If we wanted to look over at the atrial side, we could just flip this whole data set around. And because we're only lighting up from the ventricular side, really all we're seeing right now is the mitral valve orifice, which you can see it looks fairly small. If you want to go out of flexi light, you just click that off, and you're back to your regular data set. Okay? So I think when you have images that you've acquired, 3D data sets, whether you're using EchoPack or TomTech, this is a great way of just getting comfortable working with 3D images and being able to do this offline on a workstation. I think is not only is it fun, but I think it really lets you get a handle on 3D anatomy.
Can I ask? Can I ask you a question? How do you know which perspective you want to look at for which pathology? So how do you know you want to look at it from the ventricular perspective or from the atrial perspective?
The way that I choose is often dependent on whatever's going to get me a prettier looking picture. So a lot of times on surface echo, the ventricular aspect of the valve is closer to the probe a lot of times. And so our ventricular image will often look really, really nice, compared to our atrial image. Here, both of our images look very nice. You can see I'm in an atrial view right now, and you can see that diastolic doming and the thickened leaflets. But it's like when you turn it around and look at it from the ventricular view, just because these structures are closer to the probe, they just stand out a little more. And again, with rheumatic mitral stenosis, a lot of times, we want to look at the orifice, the opening. And so the ventricular view is really going to show us what the mitral valve area is. It's a little bit harder to see, from the atrial view. So next, one of the great things, again, about a 3D image is that we can measure a mitral valve area. And so the way that we would do this is going over and pushing this button called Flexi Slice. So Flexi Slice will then put us into a multiplanar reconstruction mode. And so this, you can, these types of, the way that we're going to look at this valve, you can do live on a machine while you're acquiring images. You can do this after the fact using software like EchoPack or using software like TomTech. And doing MPR is doing MPR. So it's always going to, translate. The functionality is kind of the same. When I'm setting up MPR planes, ultimately what I'm trying to do is create a short axis image and then 2 long axis images. When we're dealing with a mitral valve, it's going to be a short axis image, kind of a long axis image that goes through the aortic valve, and then a 2-chamber or a commissural view image. So the first thing I'm going to do is, actually I'm just going to unlock my slices for just a moment over there on the right, just because I kind of want these planes to be perpendicular. And then I'm going to relock them. And then the next thing I'm going to do, my green plane, if we look at the green box up here, is my short axis image of the mitral valve. So I'm going to bring this down, so I'm kind of going through the mitral leaflets a little bit more now. And then over on the right, I'm just going to be rotating so that I'm kind of aligned and on axis with these leaflets. And then what you'll notice if you look at the 3D image and you look at the 2D image over here, where's our left ventricular outflow tract? Where's our aortic valve? It's actually over here. So if I tilted this image down, you can see there's my aortic valve and LVOT. Typically, we want that aortic valve and LVOT to be kind of up at 12 o'clock. So to rotate those images, we're going to use this rotate all. The reason we want to use rotate all is because that will rotate both of these images together, just so that all of our images stay the same. So I'm going to click rotate all. I'm going to get my LVOT and my aortic valve up at 12 o'clock, so I'm kind of in a standard ventricular view here. And now, remember, what are the two long axis images that I want to display? I want one of them to be a long axis view that goes through the aortic valve, and then I want the other one to be a commissural view. So I'm just going to go ahead and rotate these planes. So now my white plane is going through the commissures, and my yellow plane is going through the LVOT. And we can actually confirm, if we look at my yellow plane, which is over here, we have what looks like a long axis view of the mitral valve. The aortic valve is kind of down here to the left. And then we have our commissural view with our white plane. And then if we want to measure mitral valve area, we'll freeze our image. I usually, what I'll do is I'll actually go into systole first, and then I'll start stepping through diastole to choose where I think the valve looks like it's most open. And so then once I've chosen my frame, one of the benefits of doing a mitral valve area in 3D as opposed to in 2D is that, remember the rheumatic mitral valve, that you have diastolic doming. And so in a 2D image, it's hard to know that you're actually at the leaflet tips. In a 3D image, I can actually make sure that my short axis imaging plane is right at the leaflet tips. And so if we look at this short axis image in the upper right, we can actually confirm by looking down in the lower left, we can confirm that this short axis image is at the leaflet tips. In a 2D image, you might, in a short axis image, you might have a valve that looks like this, and you might think, oh, that's a nice, valve, and let me just go ahead and freeze it. Where does it look like it's biggest? And you might accidentally measure this valve area. But the reality is we're not at the tips. So here, the great thing about 3D is we can be at the tips. And so then if we go into the Measure tab, we can choose Area Trace. I usually go into the fuzz a little bit just because if the images are a little bit fuzzy, we don't want to underestimate too much. So you're kind of going into the area and then clicking again. And you see I got a valve area of about 1.5 centimeters squared. And so this technique can be applied to, any time you're measuring a valve area, whether it's aortic valve, mitral valve, whether it's mitral stenosis, or if it's mitral regurgitation, but you want a baseline valve area, before you do MitraClip. This is a great way of looking at the anatomy. Does anyone have any questions about this? Is it all making sense? Okay. Yeah? Okay. Show of hands, do we want to spend more time on this rheumatic mitral stenosis data set, or do you guys want to move on to another pathology? So anyone that wants to do a little bit more time on this data set, raise your hands. Anyone that wants to move on to the next 3D data set, raise your hands. Okay, so why don't we move on to the next one? Serge, do you want to actually go ahead and do this one next? That way we'll trade off.
And just show them how to exit out of that, yeah.
So click that exit. And upper left, you're going to hit Study List. And that's going to bring us back to our main page of studies. And Dr. Harb is going to take over for this next one.
So thank you. I'm going to continue along. We're going to choose now a TE case. It's called case 3D004, mitral valve clip, P2 prolapse, TE. We're going to double click. And then, which software open? EchoPack or
I would maybe do EchoPack again.
Sure.
Just because since we're familiar with it right now.
So you can see there are two images. One of them is a 3D without color, and then one is a 3D with color. In order to select one of this clip, typically you press Control and then you select the clip. If you inadvertently selected multiple clip, you can press Control D, and then it will deselect these clips. So if you have multiple, you can press first Control D, so you're unselected, and then you decide which one you want to choose. In this case, I'm going to choose the one without color first. I'm going to choose, and I'm going to click, and with the control, and then I'm going to go to the drop-down menu. There are multiple post-processing software. There is QLab, there is EchoPack, there is TomTech. We're going to stay with EchoPack, but you can choose multiple software. All of them works slightly differently, but they're pretty much the same concept. So here, when I have my data set, I open my 4D data set. So now we go back to the image that Dr. Misaka has shown, and the panel.
And so because this is a Philips image, we always have to...
fix the gain. So when we see this image, you can see that there is a lot of gain. You can see that the quality of the image is not as good. So the two things that you can adjust are either the 2D gain and the 4D gain. So the 4D gain, if you press on it, you will see that the more you press, you're going to decrease the gain of the image, or you can change the 2D gain. And then by changing the 2D gain, you can make the image brighter or shorter. So changing the gain of it. So in order to get rid of the shadow, the one trick you can do is to go and then crop it out. So after you adjusted the gain, you can see here that I'm adjusting the gains. The one way to do it is to adjust the gain. So now you can see that the image is better. The other way to do it is to go and then crop it out. And I'm going to discuss about cropping out, but let's first just change the gain and see how it is.
For most of you guys, it's increasing the gain will make it, increasing the 4D gain will make the 3D image look nice.
So this is going down on the 4D gain, this is going up on the 4D gain. This is going down on the 2D gain, and then this is increasing your 2D gain. So you can play with both until you see that the image is best. Typically, before I start going into more processing, I just take a look, rotate the valve the way I'd like it to be rotated, and try to understand what's what. So for the mitral valve, we tend to put the aortic valve at noon, and then we look at it top down from the surgeon perspective. As you know that anatomically, the posterior leaflet has 3 scallops, and then the anterior leaflet is just one piece, but we divide it into 3 scallops corresponding to the posterior leaflet, what faces the posterior leaflet. So in this case, typically the aortic valve is here at noon. You have the tricuspid valve up at this level, maybe around 1 o'clock. You have the appendage here, maybe around 10 o'clock. So, and this is the interatrial septum. So mitral valve, interatrial septum, tricuspid valve, aortic valve, appendage. The coronary sinus runs here behind the posterior leaflet. So when we have these landmarks, the way we divide the valve is that on one side we go from lateral to medial. So next to the septum is obviously medial, next to the appendage is obviously lateral, and then in the center is the middle. So medial, middle, lateral, and then so P1, P2, P3, and the opposing scallops of the anterior leaflet will become A3, A2, A1. Now, how do we can slice it? So Dr. Miyasaka showed you the 2-click crop, which is you press 2 buttons and you decide how to look at it. The other way to analyze it, the most common way we do it is by going to flexi slice. And then flexi slice has different names differing on the vendors. For GE, it's called flexi slice. For Philips, it's called multi-view. So here, what are these planes? So let's try to understand. So you have, on the 3D rendered image, you can see that there are 2 planes. The 3D rendered image has a yellow plane, and then this is the yellow plane. And then it has a white plane, and then this is a white plane. And the blue plane is here linked or referenced to the short axis image. Can I change which one is the reference plane? Yes, you can change it. And you can see here by the color, so you can decide which one you want to mirror. In this case, we're mirroring the green. So how do we go? We first go down, and then we're mirroring this is the blue plane here. So how do we do it? We just first...
You made like a little mistake that green is supposed to be blue. So the color is blue. You guys aren't like, you're not colorblind, or maybe you are, but that's not that's causing the problem here. So the blue plane, if you look at over on the right, it's called the green plane.
So here, this green plane is actually your crop plane, your plane adjust, meaning the green plane, you can think about it where are your eyes are, and then you can see that the way you're looking is by this arrow on the top of the image here. So now, what do we have now? So we have the blue plane. I have it on the level of the valve. I have it on the level of the valve here. So the blue plane becomes my short axis, similar to Dr. Miyasaka when she was showing you how to measure the mitral valve area. And then here I decided to mirror on the 3D image to reference my blue plane. Look, if I change it to the yellow, then it will cut according to the yellow. If I change it to the white, then it will cut according to the white. So let's keep it on the green, which is the blue. And then let's now revisit. The one thing I'm going to do is here I don't see that my plane are orthogonal, so I'm going to unlock my slices. So press the lock button, rotate it until now you have the yellow and blue are orthogonal. The blue and white are orthogonal. Once you have them orthogonal, you can lock them. So now, again, we have the blue plane along the valve level. So that's why I see my blue plane, the short axis. I've decided to mirror the blue plane. And then this is the crop adjust, or the plane adjust. You can increase where you're looking from, or you can decrease. And you can see, as I'm going down, I see less leaflet detail. If I crop, now I'm no longer seeing the prolapse because the prolapse is getting above the crop adjust. If you go into the ventricle, then you're looking in the ventricle towards more ventricle. So that's why you can't see the mitral valve anymore. So let's put the crop adjust above the mitral valve. And then let's now study the valve. The way to study it, so if I want to make sure that I study every scallop by itself, so I have the yellow plane, which is this plane, which is the long axis. It's crossing both the posterior leaflet and anterior leaflet. And then the other plane, which is the white plane, I make it be the commissural plane. So I know where the commissures are on the 3D. I know where the commissures are on the 2D projection. So I make it up, and now I'm certain that I'm crossing through the commissural line. So now my white plane is the commissural plane. So I'm going to repeat. So in the short axis, you can see the commissures, which correspond to the commissure on the 3D. Put your white plane along these commissures. So this will be, the white plane will become your commissural plane. The long axis is the yellow plane. Yellow plane is crossing posterior and anterior leaflet. That's why it's called long plane. And then this is how you see it here on the yellow plane. If you get confused and you're like unsure which is posterior, which is anterior, look for anatomic landmark and try to cross-reference your image. Meaning, here, if I'm uncertain which one is anterior leaflet, which one is posterior leaflet, I see the aortic valve on the top. So what I'm going to do is I'm going to move my crosshair to the aortic valve, and then now I see where the aortic valve is, I see where the aortic valve is, I have it in short axis here. If I'm uncertain which one is medial or lateral, I need one reference. So typically when we're doing cases, and sometimes it becomes confusing, and you're like uncertain, which one is this on the white plane? Which one is medial, which one is lateral? It's a bit, I'm a bit uncertain, but what I'm certain of is the landmarks on the 3D image. We said that the tricuspid valve is here. So all what I need to do is to move medially on this short axis. And I'm moving this way, so I know this is medial. So now if I go back to the mitral valve, I know that this side is medial. So moving this way is getting me medial. And actually, if you move it here, you can see that it's going medial. And then if I move it to the opposite side, moving to the left atrial appendage, I know that I'm moving lateral. So I know that this is lateral, this is medial, and this is central. Now, if you really like, you prefer to have this being the 60-degree view, meaning you prefer to have medial on this side and then lateral on the other side, all what you do is you can unlock your planes, and then on the short axis, just rotate the white plane 180 degrees. So now I've rotated my white plane 180 degrees. Let's see if I achieve what I aimed for, which is having this side being medial. So let me move it to the medial side, yes. So now I move this, I'm medial. So what do I have now? I have a long axis view in the yellow plane. I have a commissural view on the white plane. I have my short axis here. So I have the two most important planes, which are where is the pathology and then the extent of the pathology. So where is the pathology is the yellow plane, the long axis plane, and the extent is the white plane, how far it extends from one side to the other. If I want to study each part of the valve by itself, what I can do is take your crosshair and let's start from medial. So I'm going to put my crosshair on the medial side, and now I know with certainty on the yellow plane I'm seeing P3, A3. So P3, A3. I am certain. Imagine that you're looking on 2D. It's impossible to know if you're cutting P3 or P2 because look, I can do this, rotate it, and then now I'm cutting through P3 and maybe A2. How can I determine this by 2D? It's impossible. So let's go back, make sure that we're cutting through P3 and 3, and then we can study P3, A3. And on this image, P3, A3 looks to be healthy. There does not appear to be any pathology there. Let's move now and study P2, A2. So what I do is I take my crosshair, move it to the center of the valve, and orient it in a orthogonal fashion to the commissural line, like the opening of the valve. So now what I can see is that I'm certain that I'm studying P2A2. So I look at the long axis and I see that there is a clear P2 prolapse. And then the opposing leaflet, the A2, looks to be okay. The posterior leaflet 2 looks to be prolapse. Now, in terms of how wide is this prolapse, then I put my crosshair again on the prolapse, and I can see that the white plane is cutting through the width of the prolapse. So it's cutting through the valve from the prolapse segment from one side to the other. So I can see the extent of the prolapse. You can even measure it. But the point is to see that how broad it is and where the pathology is. Now let's study the lateral aspect of the valve. So I'm going to move my crosshair to A1, P1. I'm going to clock it tiny bit so I remain orthogonal to the opening of the valve. So now I know with certainty that I'm at the level of P1, A1. So when I look at the valve, I know that I'm studying P1 here and A1 here. And again, if you get confused which one is P1, which one is A1, you need only one landmark. So look at the 3D. Oh, aortic valve is to this side, so I'm going to move my crosshair towards the aortic valve, and you can see that here the crosshair has moved towards the anterior leaflet. Same if you move it posterior, it will go posterior. And then here again, if you get confused, am I lateral or am I medial, you can always cross-reference and move these. So by studying this valve, we can determine that this valve has a large segment of P2 prolapse. The anterior leaflet looks to be healthy. If you're planning to do a mitral clip and you want to measure mitral valve area, you do the same what Dr. Miyasaka showed for the measurement of the mitral valve area. You stop it. I typically go frame by frame and see the maximum opening, which is typically early diastole. I see where the maximum opening is, and then I take my crosshair, put it at the leaflet tips, get a short axis, and then you click measure, and then once you click measure, you can measure the valve area. Few useful tools, again, as we said here, if you can change the reference line, if you increase the slice thickness, you will see that the image becomes more blurry. So you're summing multiple slices to display them. You can rotate 4D and rotate all. The difference is that when you rotate 4D, you rotate the 4D image, and then it rotates with it. When you rotate you rotate all, you're rotating the two cross-referenced images. So again, when you're rotating if you're fixing the green, which is the blue, you're rotating both. When you rotate 4D, you rotate the 4D image, which makes all the planes also rotate with it, because these planes are also affiliated to it. Dr. Miyasaka spoke about the two-clip crop. Should we talk about 4D markers? Or move to the next one?
I believe we should go to the next one.
Do you want? All right. Do you want to do the color, or do you want to do the next case?
Maybe we'll do the next one. We'll do tricuspid and then aortic.
So I'm going to pass it back to Dr. Miyasaka to do the tricuspid.
Or is it translate or translocate?
The translate, once you've set up your 3D cropping plane, translate will just move that plane kind of in one direction or the other. So sometimes you've got your cropping plane set up, and then you're like, oh, I wish I had cropped actually a little bit closer to the structure. If you hit the translate button, it'll either move it a little bit closer or a little bit farther.
Is your eyes looking from the cropping to whatever color line is in between?
Yeah, so when you're in this flexi slice, our cropping plane is that green plane. But if you do like and our eyes are the direction that the green plane is from. If you do a two-click crop, then you don't have that cropping plane necessarily after you do your 2 clicks. And so then you can use the translate to kind of adjust it back and forth. If you want to flip to the other side, then there's a tool called flip crop that you can use. Or you can just manually flip it around. These are just different ways of kind of tweaking your cropping. It's different ways of achieving the same thing ultimately. So I tend to primarily work in NPR and do my cropping with NPR because then I know that I'm on FOSS. But if you just want to work with the 3D images, then there are different ways of cropping that way. Any other questions relative to the mitral case? So I think the one other thing I'd add to the mitral is that this is our exact workflow when we're evaluating patients in the TA lab for mitral clip. This is the exact workflow that we use in the TA lab. And of course, we would be adding color, on and off at each of those stages that Dr. Harb was mentioning. It's just that when we're doing this after the fact, we can't add that color on and off. And so that's why we, just focused on the 2D image.
All right, we're going to move now to the tricuspid valve TTE.
Okay. It's number 5, quad TV. So you may get a little bit of a hint of what the anatomy of this tricuspid valve is. And I love doing transthoracic echo for the tricuspid valve, and specifically, getting a nice 3D image of the tricuspid valve is actually often very possible. And so I think this is a place where sometimes 3D imaging is maybe underused a little bit. You can often get 3D surface echo pictures of the tricuspid valve that rival or are even better than transesophageal echo. And that's just based on the fact that the tricuspid valve is kind of a more anterior structure. And so a transthoracic ultrasound probe, we have different imaging windows where we might be able to visualize it very nicely and have the probe close to the valve. Transesophageal echo, the tricuspid valve tends to be far away, so sometimes our images aren't as good. Okay, so what I'm going to have you guys do now to select this, it's going to be the same process. You're going to hit the, keep the control button and then left click to select. And then again, we'll be using EchoPack. Okay, so if we want to, really quickly, just look at the 3D anatomy of this valve, we can use that 2-click crop. I'm going to start in the ventricle. I said that on surface echo, I kind of like looking from the vantage point of the ventricular view of the valve just because it's closer to the probe, so the image tends to be a little nicer. And the another thing that's nice about a ventricular view for the tricuspid valve is often that is a nice way of seeing the scallop so that we can understand how many leaflets there are. So I'm going to click in the ventricle, and I'm going to drag down towards the atrium. And you can see that my 3D image of this valve is a beautiful ventricular view that we're looking at here. And in terms of trying to get oriented, so I can see this is my tricuspid valve here. You can see this is the ventricular septum. And so this is the mitral valve up top. And if you wanted to confirm that, you could actually kind of roll around. We can see that's some aortic valve right there. We could roll back around this way and, just make sure that we understand where we are. So if our mitral valve is at the top of the screen, from a ventricular view, typically the mitral valve will be on the right and the tricuspid valve will be on the left. That would be kind of a standard tricuspid ventricular view. And so I am now going to rotate this image around. Actually, we can actually just grab this to rotate it around, or just grab it, rotate it around. And then I'm going to have my mitral valve on the right, tricuspid valve on the left. When you're in a ventricular view, the other hint that I often will use to get my orientation straight is looking for the RVOT. So I can see that the RVOT is coming off here anteriorly, so that's another hint to get anterior up top. So now we have this really nice image. The leaflet that's closest to the ventricular septum is going to be our septal leaflet. So there's our septal leaflet right there. Our posterior leaflet is down below. And then we have this large anterior leaflet that has 2 scallops to it. So this is a tricuspid valve that has a configuration of 4 leaflets. We have 2 segments to the anterior leaflet, and then we have a septal leaflet and a posterior leaflet. So we've actually gotten a ton of information just from a surface echo. So when patients are coming in for their TR evaluations, we can actually get a lot of anatomic detail to know kind of where we're heading. So now we're going to do some MPRs. You're going to click Flexi Slice. I don't know why the software does this, but they don't start perpendicular, so I often will unlock my slices, as Dr. Harb just did. I just make my planes perpendicular, and then I lock them again. What's the secret sauce to valvular imaging is create a short axis image and then 2 long axis. So I'm going to have my green plane is going to be my short axis image. So I'm just bringing that down to the level of the valve. I want my green plane to be parallel to the annulus. So I'm going to counterclock just a little bit here. And now I see this really nice short axis image of the tricuspid valve. To get this into kind of our more anatomic view with RVOT kind of at the top, I'm going to rotate all until my mitral valve's over on the left and the RVOT is up top. And now we see we have a nice 3D image showing 4 leaflets in the upper left. We have our short axis 2D image showing 4 leaflets upper right. And then we have these 2 kind of long axis images. Now, when we're thinking about tricuspid edge-to-edge repair, or TriClip, for example, what we're often trying to understand is what our leaflet anatomy would be if we were trying to grasp a septal leaflet to a lateral leaflet. And so if I'm looking at my septal leaflet here, and I'm looking at my anterior leaflet over here, we typically would want to think about grasping, so that we're counterclocking this plane just a little bit. And now what we're actually doing, my yellow plane would be a potential grasping view, and my yellow plane over here is showing us what our leaflet anatomy is. So if, for example, we said we want to do edge-to-edge repair and we want to start near the septal anterior commissure, that yellow plane would be all the way up near the septal anterior commissure. And then this is what our leaflet anatomy looks like. And I can actually do a sweep. Again, if we were doing this live, we could be adding color on and off, but we can do a sweep starting anterior and then slowly moving this plane posterior, and at each level looking for TR. So looking for TR and then also looking at leaflet anatomy. And then again, if we're thinking about, is this patient potentially candidate for edge-to-edge repair, we can kind of scroll through these frames and find an image where we can actually see the leaflets nicely, and we can measure the leaflets. So that's one of the things that we'll look at if someone's a candidate for edge-to-edge repair is, are your leaflets long enough? And so we can kind of do a simple leaflet measurement. This is also how we would measure coaptation gaps. If this patient had a large coaptation gap, we could put our, this plane right through the coaptation gap, and we could do a coaptation gap measurement that way. So we can get a lot of, again, a lot of really detailed data, from 3D surface echo. You can even see, I did the measurement. I'm going to exit out of that just so that I have all my 3D controls back. But on the surface echo, you can see cords. We can see these cords going into, pap muscles. So you actually get a lot of anatomic detail here in this view. We can see cords and inserting into the pap muscles, into the ventricle. So super cool, really nice to work with. Any questions about tricuspid valve anatomy? No. Okay. Amy, did you want to come up and do a...
Yeah, thanks. All right, we're going to... Any questions for Dr. Harb or Dr. Miyasaka while they're still here before I take over as a sonographer? Any questions? So the last case we're going to get out of that prior case by hitting the exit button and the echo pack until you get to this spot. Is everyone at this spot? If not, raise your hand. We'll get you to this spot. Oh, we got a couple that need to get back to the patient list. The last one we'll do will be a little different because we're going to use TomTech software, which is based on the cart typically of a Philips package. So we were using EchoPack, which is a GE-based system on the prior, and now we're going to use TomTech. Both are similar, just look a little different, and you use them a little differently. So the case we're going to do is this first case, bicuspid aortic valve, case number 1, so we'll double-click on that. And you should have at least one image. You might have a multiple, that's okay. This is a TEE for a bicuspid aortic valve, and we're going to just take a peek at it. If we want to, we'll try another valve area again. This is the most practical thing I think we can use with these valves when they look like they're stenotic. What you'll want to do is select this. So you're going to hit the control button and hold that down as you select it like we've been doing. So that will highlight it with this yellow square around it. Once it's highlighted, then you're going to come up here. We're not going to click on EchoPack because we're going to use something called TomTech. So you're going to use this drop-down arrow and select what we call TomTech. And that will get you to our next screen. If you're not here, let us know, raise your hand, and we can help you get here. Okay, so once we are here, we want to work on this data set. So we are going to, we have someone over here that needs a little assistance. Yep, thank you. All right, we're going to right-click on this data set in the top left, and you'll see a drop-down menu appears for you, and it's going to give you a bunch of options if we want to do strain or some 3D volumes. We want to do what's called 4D Cardio View 3. Right here in the middle, you're going to click on that. Yep, so you're going to right-click on that image, right-click on it, and that gives you the drop-down. So everyone should be able to access this drop-down, and then you click on this 4D Cardio View 3. And that will get you finally to where we want to be, all those clicks. Okay, everyone in this position now? Okay, if not, again, raise your hand. We're going to use the MPRs again. This is a really nice feature to be able to use when you're doing valve areas. And our goal is to align the long axis and the short axis and make sure we're completely on axis for our valve area. So I like to start over here in the left-hand corner. You can see we have our colored plane. So we have this teal color here, which we can see that also is here. And that's going to be this box. So you can see each of these planes has a line through those, which then represents the box, which is right here. So we're going to take this teal blue colored plane, and we're going to rotate it from the left. And as I rotate that, you can see both of those planes move together. They keep that 90-degree perpendicular angle, and then we lock it there. So my goal is to have this teal or blue colored long axis plane right through the center of that aorta and LVOT. And this is applicable like we did with the mitral stenosis case. Any of these valve cases where there's a stenosis, this is the same process, just different, obviously different valves that you're working with. So I like the way that my long axis is aligned. Now I want to make sure that my short axis, this purple plane, which is represented over here in this right-hand corner, I want to make sure that's at the leaflet tips. That's the key when we're trying to do a valve area. So the best way I feel to do this is to pause it. So up here, our pause is going to be up here in the center. There's this pause button. I'm going to click on that, and that's going to stop the playing. I want to go frame by frame until I see that valve is open in mid-systole. And you can see actually during systole that my long axis moves a little bit. So I want to kind of recenter all of this to make sure that I'm right in the center of that LVOT and the aorta during systole. Because as Rhonda was mentioning, Dr. Miyasaka, that the valve opens and closes, and during systole it may move a different plane. So you want to make sure that you're lined up appropriately. Okay, so let's play this and see what this looks like. There's a play button right where that pause button was. There's also a play button, so you can just hit that and see what this looks like. I'm going to line up in this bottom left-hand corner, this yellow plane, again, directly through that aorta. And so now you can start seeing on this top right-hand corner, which is that short axis plane, this purple plane, it's going right through, and I'm starting to get now what looks like a bicuspid aortic valve. Everyone see that in the top right? And so I know I'm assured that I'm on axis, I'm assured that I'm at the leaflet tips, and I'm assured that this is going to be a pretty accurate measurement. Like Rhonda said you can, Dr. Miyasaka said you could measure from the 3D image. I can lock in the plane here. I personally like to measure from the 2D image, so you can do either or. I know she measured, I think, from the 3D image. We're going to practice measuring on this 2D image. I can make this image bigger. I'm getting older, I need to see better. I can click on this right-hand corner, this purple box, to make it bigger for me. And you can do that with any of your boxes in that quad. But for this one, I want to look at this really nicely. If you want, these can be distracting sometimes, these planes. So if I want to get rid of these planes temporarily, on this right-hand corner that looks like a toolbox or some sort of hammer, I could click on that and come down and say I want to get rid of the lines of intersection. That's a choice. You don't have to do that. It's just kind of an extra perk if you wanted to. So I can keep them on if I want to move those around a little bit, or I can remove them. I'm going to remove them just so I can get a really good look at that valve area. Okay, so up here on the right-hand corner, we have these 3 tabs. I'm going to go to this middle tab now. These rulers mean measure, right? That makes sense. So I'm going to click on the measurements tab. And I now have some options for diameter measurements. I have options for an area measurement and some other measurements. So I want to go with this area one. I want to make sure that my timing is correct. So again, here's the play button, here's the frame by frame. So I like to go frame by frame to where I see that valve open really nice. So you guys keep scrolling through until you get to that mid-systole where you have a really nice bicuspid aortic valve orifice. I now can measure the valve area. So let's see what we get. Let's see if we're similar. Of course, I'll be the gold standard. Just kidding. I'm just making that up. Okay, so you're just clicking. This is a connect the dots thing. So I'm just clicking, 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 trying to follow the valve orifice. Bless you. So I have a valve area of about 1. Anyone have something similar to that, hopefully? Around 1-ish. We're all going to be, okay, somewhere in that range. Any questions on how to do this, how we got this, how to measure valve areas? Okay, great. So the other option you could do with this, I'm just going to get out of this big image by just hitting this box in the right-hand corner again. There's these 4 squares. That gets me back to where I was in my big image. I'm going to go back to play this again. So we did this using MPRs. If you wanted to look at the valve sort of like 2-click crop that she was doing in the echo pack, you can do that here also. It's this button right here in the top left. It's called DART. If you click on that, you can do what we call that 2-click crop. So you can say, I want to look at it from the LVOT perspective up through the aortic valve, and I can get my 3D image there on the right. Or if I want to switch and look at it from the aortic perspective, I can do the same. I'll click that I want to look at it from the aorta. Oops, let's try that again. There we go. Aorta, and I want to look at it coming down in through the orifice into the LVOT. So that's the equivalent of 2-click crop when you're on TomTech. It's called DART. Any questions about that? Okay, they're both similar, just different ways of kind of driving the car here and figuring out what you want to look at. All right. Anything else we want to look at before? I think we have about 5 minutes left or so. Any other questions that I might be able to answer? Any other? Yes. A 3D, I'm sorry. Vena contracta area. Yes, let me see if we can. So the question was to measure a 3D vena contracta area. Let's see if we can find a case with that. We'll exit out of there. On the right-hand side, there's a little X here, so we're going to hit X. That gets you back to your original case. And then to get back to my cases, I'm going to go under study list. Let me see if we have a... Yes, so we had that mitral valve, that prolapse. Let's see if we can find a color picture for that one. So let's see if this will have it. This case number 4, which is mitral valve clip P2 prolapse. We were in that one earlier. We're going to click on the right image. That's the one with the color on it. So we want to click on that right image. And I like to go, let's go back into, instead of TomTech, let's go back into EchoPack. So we're going to click on that button in the middle, and we're going to use a drop down, and we're going to go into EchoPack. And you should have something that looks like this. It's the image inside of an EchoPack. So we're going to want to, let's get to, I don't know if it's going to let me do with color on this. Sorry, stay where you are for a moment. I'm going to go into TomTech and see if it'll let me do TomTech. Yes, let's use TomTech. Okay, sorry, I apologize. We're going to exit out of EchoPack, which is that center middle exit button in the middle. You're going to click on that. We'll stay in this image, but we're going to go into TomTech instead of EchoPack. So you'll still have that image highlighted, and we're going to hit this TomTech button in the middle instead of EchoPack. So you're pulling up that same image just through a different system. So it should look something like this. If you're not here, let us know. Raise your hand, and we can help you get there. All right, we're going to look at this with the MPRs. That's how we're going to find a good vena contracta, 3D vena contracta. So what we'll do is we're going to use this image on the top left. We're going to right-click on it again. And we're going to go into that 4D Cardio View 3. And that will bring up your image with color. And the goal with this is just like we do with our valve area, it's aligning the planes and making sure you're right where the vena contracta is in that, the valve orifice. So what we'll do again, starting on the left-hand side, it's personal preference. I like to start on the top left, and I will rotate. It's moving a little bit slower and sort of slow frame rate just because of the color, so that just kind of be aware of that. I'm rotating, and I want my blue plane, my short axis of plane, to be right where I'd measure a vena contracta in 2D. So be right where the leaflets coapt. That's where I want to put my, my short axis, the level of that area. I'm aligning that purple long axis plane right through the center of that mitral valve, or through that color flow. Color flow is sort of our guide now, so I want to put it right through that color flow jet. And again, there's a little glitchiness, so sorry, just sort of bear with me with the color. Obviously, you see the color really slows frame rates down when you're doing 3D imaging. On the right-hand side here, I'm going to, again, sort of try to align the best I can this plane through that color flow. Stay there. I'm rotating because, again, I want that long axis right through the center. So now we have this teal blue plane that's right through the short axis at the spot where I'd normally measure a vena contracta. I am ensured that I'm in the right plane. I have my long axis planes lined up, the yellow and the purple. I have my blue short axis plane lined up very nicely. So now I can measure from this bottom left-hand short axis blue plane, the 3D vena contracta. So what I can do, or the vena contracta area. So I can make that bigger. Again, I want to see it bigger, so I'm clicking on that square, that teal-colored square, that right-hand corner of the bottom left. So that's going to make it bigger for me and easier to be able to measure. I'm personally just going to get rid of these lines as well, the planes, because I want to be able to see them a little bit, the area a little better. So I'll go to that right-hand corner where the hammer is, click on the tools, and just say I want to get rid of these lines of intersection. And I click that off, and now they disappear. All right, so I could optimize the color as best as I can here as well. If I feel like there's a lot of bleeding, a lot of difficulty seeing what I want to see, I can play around with this threshold and sort of make it as best as I can to be able to see that blood. That looks pretty good there. So then it's a matter of just freezing it and going frame by frame. So again, I have my play pause. I'm going to pause it, and I want to go frame by frame. This is probably going to be more towards late systole because it looks like it's a prolapse, and the color would be more like a late systolic color flow. So I'm looking at the valve orifice. And I would probably go somewhere in here. And then what you would do is you would go under your measurement tool where we did our valve area right here. And then I'm going to go under this area measurement. And what I would do is I would do my best. Again, this isn't like the best color flow of this. It's a difficult case. If it was a nice big functional MR, it'd probably be easier to measure. But this is how you would do it. You would then go ahead and trace your area. We're just going to hypothetically say it's somewhere in here. And this is how you would get a 3D vena contracta area. So the area we'd say is 1.9 centimeters squared. Does that answer your question?
It does. I was just wondering in terms of, because you see that there's a lot of more that you didn't.
There's a lot, right. So I was sort of, and let me just see and go back. This, I want to try to optimize the color a little bit better, and I'm going to see if I can do that. So you can see the valve just by, I minimized the color a lot. You can see the valve sort of ends right here. So there's a lot of color bleeding out into here. So I definitely don't want to measure in there. And so I'm just sort of using my judgment of where I feel like the valve, I don't want to measure beyond that. Like I'm not going to measure, this is just some bleeding artifact. And so, do you need assistance? Oh, just, yes. Let me get out of this. Oh, got it. See it. Let me get out here. Let me cancel this. And let me get my planes back on there. Sorry, I took them off. Let's put them back on. Here we go. You're saying this, right? Yep. Yep. And this one would go right through the center there. It's obviously a little challenging with a prolapse case, but I think this is probably a little better. Something like that. I assume, are you okay with that? Yeah, okay. And so the same process, like I mentioned, this is the short axis. You would click on that, bring that up. I won't remove those planes again for you just so I don't waste your time. And then I'll go to my area, and you'd measure that. The key here is making sure that short axis lines up to where your vena contracta is, where the narrowest part of that jet is, where that coaptation is, and then you can, and then the other thing that you could do is if you want to see how that vena contracta changes, I've seen folks, if you kind of bring that longitudinal plane back, medial and lateral, you can look and see where the vena contracta looks largest or where the Pisa looks largest. I've seen that as a utility or some sort of tool to use as well because, Pisas are not necessarily a nice hemispheric structure. It can be long and wide and especially functional. So this is a nice tool as well when you're using 3D with color to be able to look and see where you have your largest Pisa and be able to identify that and measure it there. I'm taking these crosshairs, so you have your, it depends on which screen you're on, but I have here the blue and the yellow, and I'm sliding it medial and lateral. So I'm sliding it left and right. And then as I'm doing that, you can see on that bottom left hand, you can see the formation of the color flow, I guess you can say, or the shape of the color flow can change depending on where I am sliding medial to lateral. And there's some automated post-automation sort of things you can work with also with Pisas that can help you calculate 3D Pisas on some of the software as well. All right, good. Any other questions about this or anything else? Yes? For that first one's a little bit bleeding, I would absolutely work with the color optimization. So on TomTech here, and it's also on EchoPack, and it's going to be on your cart, but you can see how you can help with some of that bleeding. You can play around with some of your color to kind of make sure that you're prioritizing the color flow and optimizing it. So I would absolutely suggest doing that, with, especially, like I said, prolapses are kind of tough for measuring vena contracta. This is the only one I had that had color on it. But, it'd be a lot easier if you had a nice functional MR that was in a nice central juicy jet that you can measure. That'd be a lot easier than some of these prolapse cases. But, yeah, I would absolutely suggest manipulating some of your color, and I'm trying to make sure that you don't want to falsely eliminate some of the color there, but you want to make sure you're optimizing and rejecting some of the lower velocity color flows that are necessary, that are artifacts typically. Good. Any other? Yes?
Would you, if you were capturing a 3D color data set, would you just turn off the wall filter? And would that be the same sort of thing?
Yeah, you could, yes. So the question was about when you're capturing a 3D data set. So the first thing you want to pay attention when you are doing that, your frame rates are going to drop significantly. So you always want to make sure that you have a nice narrow sector to make sure that you're increasing your frame rates and improving your temporal resolution, but also keeping all the structures of interest that you want to. When you add your color on there, you can optimize your color at that time in the 2D. And once it looks optimal in your 2D, then when you go into 3D, it should be pretty good. You could use wall filter and some of those features when you're doing your 3D capture. I think the post-processing is pretty good with doing that as well, but I think it wouldn't hurt. The key I always think about when I'm doing color Doppler with 3D capturing is those frame rates, because you can have frame rates that are really low and they make it almost impossible. These frame rates, I think, aren't bad. I've seen some in the single digits that are really difficult. So just keep in mind your frame rates. You can narrow your sector, decrease your depth. You can try to manipulate some of the quality imaging there and try to get that temporal resolution up a little bit. Good questions. Any other questions or comments just about the session in general? All right, well, we're around all weekend, so if you have any other questions, feel free to grab us and ask us any questions you may have or anything else that pertains to 3D or any other questions at all. We appreciate your attention and hope you found value in this. And you're welcome, and have a good day.